Erin, welcome to the show. I'm so glad you're here. This is going to be a blast.
I'm so glad to be here. Thanks for having me.
I probably shouldn't have said Erin. I should have probably said Dr. Sheffield. Paid you your proper respects.
I appreciate that. That's a big problem with women in healthcare, in medicine, and surgery. We will be at big events and they'll introduce all the speakers, for example, as Dr. So and so, and then the woman will get up and they'll say, Erin. So I appreciate you being cognizant of that. But you can call me Erin. That's okay.
Okay, well, as long as I have permission, then.
You have
But I should have
permission.
checked first.
You should have.
Dr. Sheffield, being a woman in a male dominated field, that's got to be extremely interesting. You're an oral surgeon. Can you tell me a little bit about like that, how that journey was for you, like going through medical school and doing your residencies and all that, and then like give me kind of like what is it like being a female in like the medical field?
Yeah, there's a lot to unwrap there. I'm an oral maxillofacial surgeon. That's the technical name of my specialty. And to do that, you have to start as a dentist. So usually that's going to be a 4-year program. Once you graduate dental school, you'll go into residency, which is either a 4 or 6 year program. So that's really confusing for people. That extra 6-year program, some oral surgeons will get their MD degree as well. So they'll be both physicians and dentists. Or you can stick with the 4-year route. But both routes are hospital based trainings where we learn extensively to care for pretty much anything in the head or neck region, including, facial fracture repair, facial reconstruction, oral cancer, facial plastics, and then the stuff you normally think about, the bread and butter of oral surgery, which is like dental implants or wisdom teeth removal, things like that. So that's who I am and what we do, which no one seems to know. So now you guys are ahead of the game. Being a woman in medicine or in healthcare is sometimes a challenge. And in our specialty in particular, about 8% of women, 8% of oral surgeons are women. And that's the lowest percentage in all of medicine that I've seen, even including those specialties you normally think of as male dominated, like orthopedics or neurosurgery or urology. So we've come a long way since when I was in residency about 10 years ago. It was only about 2%. So we've joined a lot to our ranks, but we're still pretty behind.
All right. Besides like the kind of the conference thing you described earlier, like where else do you see like, for example, like one of my clients is a pilot for a major airline, and people will ask her for drinks and refer to her as like the flight attendant, things like that all the time. And she is, obviously that irks her quite a bit as well. But like, have there been situations like that in your like coming up in the medical profession?
Oh, yeah. I think most women in our specialty see that every day. I have to be very clear who I am when I enter the room. I remember in residency, we had these tags that would say doctor in giant yellow letters. And I would go in and say, hello, I'm Dr. Sheffield. I'm going to be doing your procedure. I'd explain the whole procedure. And it wouldn't be uncommon when I went to numb the patient that they would like look in surprise and pull back and go, when's the doctor coming in? Like they somehow didn't figure out after all of that I was a doctor. And then finding out the other residents just say, hey, I'm Bob or I'm Dr. Bob. And they're like, thank you, doctor. So those little things happen pretty frequently. We get pretty used to them. Just people not knowing who we are is a big part of it.
That's interesting. I'm neither in the medical field nor a doctor, so I can't, I can't speak to that. So I was curious. Um, the reason I really wanted to chat with you today is because you're an expert in oral health and oral hygiene. And I think that kind of talking about fitness and nutrition and longevity and just keeping ourselves healthy longer, I focus on the nutrition, I focus on the movement, I focus on mindset to a certain extent. But I really have never focused on oral health. And I know that we think about it. It's like, oh, we should probably brush our teeth. I definitely need to be flossing more. But I want to get a little bit of like a deeper look and a better understanding of how our oral health impacts our systemic health, and what can we be doing for our oral health to make sure that we are keeping up with the rest of the nutrient supplements stuff we're doing to make ourselves live longer and get healthier.
I'm so
That's a
glad
broad
we're
question.
I'll try to remember all the points. I'm really glad we're having this conversation because this is actually a personal pet peeve I have, that medicine and dentistry have been separated from each other for such a long period of time that I think oral health gets left behind a lot of times.
Mm-hmm.
And if you go and talk to your doctor about something going on in your mouth, I feel like they'll usually look past all the white things and back to your throat and just have very little understanding of what's going on. And I think that can be harmful to patients. And it's not that they're doing it on purpose per se, but I always say some of my physician colleagues, when we start talking about anything oral health, it's like their brain turns to gobbledygook. And, I've had consults like, come to the ICU with this really sick patient. We looked in their mouth and there was goo in there. And I would guess that you, even as a layperson, would know goo is not a medical term.
Oh, they would
Usually we're
literally say
using,
there's goo.
someone literally said that to me once. And so, I'm like, there are so
Tell me
many
more
more
about the goo.
descriptive terms. Is it mucus? Is it saliva?
Well,
Is
I tasted it.
it
It tasted a lot like goo to me. So
drainage? Is it pus? Is it leftover food? So I think sometimes they're so intimidated too that they don't even know how to talk to us. And sometimes it leads to problems with just getting the care that patients need. But I think a big part of it, without having to be a patient, is just it's an area that we tend to overlook in our overall health. So, people are really into biohacking or getting their fitness and nutrition game on par. This might be one easy piece of the puzzle that we're missing, but it is so important just because doctors and dentists have been traditionally separated for so long, and dental insurance and medical insurance have been separated, doesn't mean that our mouth isn't a very important part of our body. And I was thinking about, even when you mentioned supplements, this idea of, pretty much everything we take into our body comes from our mouth. It's coming through our mouth. That's kind of the gateway. So when we're talking about nutrition, et cetera, it's so important.
all right. So just give me an answer on this. I know probably the answer is it depends, but I got to know, how many times a day do we need to be brushing our teeth?
So that might be a little different for each individual, but the
Mm,
standard would be 2 times a day would be the recommendation. Now, the reason I'd say it might be different, if you're really prone to tooth decay, then that might need to be more. But if you're going to the dentist every 6 months and they're not finding cavities all the time, then probably what you're doing 2 times a day is working. And then a big piece of the puzzle that people like to forget or purposely ignore is definitely flossing. Flossing is so important, so much more important than people realize. It's not just about getting food out from between your teeth. It's about lowering inflammation and infection in your mouth and in your gums.
okay. So if I had to pick one, if I only had time to do one thing, brush my teeth or floss, where am I putting my energy?
Oh, that's a hard
And don't
one.
say, look at my screen time on my phone. I'm not here for that.
I would say, Hmm. Maybe flossing because, if you use your tongue and you're drinking water and things like that, you might be able to get most of that debris off of the teeth, but you can't get between the teeth. And that gum disease that happens when you don't floss, at least for a lot of people, can happen. That's something that, you know, people don't think about, but flossing is really going to prevent that
All
more than
right. You heard it
brushing
here
would.
first. Flossing over brushing your teeth. So that's how important it is. If you brush your teeth, you might
Preferably,
as
you'll
well
do
just,
both.
and apparently twice a day, which, that's hit or miss for me, depending. So
Yeah, and flossing once a day is usually enough for flossing, thankfully,
yeah,
because
but I
no
eat
one likes
steak at
doing
every
that.
meal. So just kidding. I did have like a 10-ounce ribeye the other day and like 2 pieces of sourdough toast. And that was a great lunch. And I took a nap immediately afterwards. So if you need a nap, 10 out of 10 would recommend that lunch. Then I had to floss in the afternoon. Okay. So Erin, I want to go back to what you said earlier about flossing being really important because of eliminating disease and inflammation. Can you talk about that a little bit more and how inflammation in the mouth actually can impact our systemic health, the health of our entire body?
Yeah, definitely. There are studies coming out showing the impact that our gum health can have on our bodies. And we've known for decades that gum disease called periodontal disease or periodontitis is associated with, for example, low birth weight babies and preterm babies. So definitely has an effect on pregnancy and mothers and the babies. And we've known that for a long time, but I think we're starting to see more evidence for cardiovascular health. The periodontal disease might be associated more with cardiovascular disease, atherosclerosis, the hardening of the arteries, and
Mm.
maybe even dementia and Alzheimer's. So they have found in some studies that one of the bacteria in our mouths associated with gum disease, called P. gingivalis, is found often in the brains of patients with Alzheimer's. So
Wow.
it could actually be the bacteria getting in your bloodstream and traveling to parts of your body, like your brain. It can also travel to parts of your heart or get to your heart and cause something called endocarditis, which is a valve infection of your heart. We know that, but it might be more likely to be related to inflammation.
Okay. So you touched a little bit on atherosclerosis, which is a really hard word to say. But basically, that's like what we're talking about is like the hardening and the buildup of plaque in your arteries, which can result in a clot or can result in higher blood pressure, can result in like eventually heart disease. Um, is there any correlation between that, like the periodontitis and cholesterol that you're aware of?
Well, first, a periodontist is a dentist who takes care of your gums. So it's
Periodontitis.
periodontitis. I just feel
Oh
like I need to stick
heavens!
up.
No,
I
you
need to
do, you
stick
do.
up for
And I
my
said it, and I was like, "Is this
periodontal.
right?" I don't even know.
I just want to stick up for my periodontist friends just in case. So
What can you tell us about the bad things about periodontists? I'm just kidding.
a
No,
lot
but
of that is a rivalry. And so that's kind of a dangerous place to tread. So I'm going to stay away from that question.
but if you listen to Erin's podcast, resting Stitch Face, you'd be able to lean into the controversy between oral surgeons and periodontists. That's probably the first like 12 episodes. I'm assuming.
I do have on my list, honestly, of something to talk about. So yes, come for all the drama.
Come for the drama, stay for the oral surgeon stories.
Right.
So in your experience, or in have you noticed any um, correlation between cholesterol and periodontitis? Because I feel like both of those things get kind of that we talk about atherosclerosis when it relates to both of them.
I don't know that they found a link with cholesterol per se. I think it seems to be more associated with just inflammation.
Okay. All right. Well,
But
I'm not a doctor. Said that earlier. So, but I've also found in reading and listening to other people who are experts that a lot of times the cholesterol is not the actual problem; it's the inflammation that causes like the swelling of the arterial lining that
mhm.
can cause the cholesterol to build up in there. So it's not an issue until you get really like inflamed, have sticky blood with a lot of sugar in it, et cetera. So
Sure.
tell me a little bit about how does what is the inflammation? Is it just like a buildup of bacteria, kind of similar to like a petri dish in our mouths? Or how does that work?
Yeah, people don't realize how easy it is to get inflammation in your mouth. If you brush or floss or just even eat and you get bloody gums, that's inflammation.
Mm.
And so it's really easy to kind of see if you have, if it's bad enough, it's bleeding, you definitely have it. But the thing to know, anyone who's not brushing or flossing adequately, and I have a lot of patients who say, I do brush, and I'm looking at their, bleeding gums and they got gunk all over their teeth. Just because you are doing it doesn't mean you're doing an adequate job. So that's something definitely to talk to your hygienist about and get some tips. But everyone if you're not doing a good enough job brushing and flossing, you have gingivitis, and that's inflammation of the gums. Now, what can happen with that is that can progress in some people, not everyone, but in many people that can progress to periodontitis, which is the disease where not only is the inflammation causing your gums to bleed and maybe be kind of swollen, and it's a response usually to that bacteria that you're not removing adequately from your teeth and from your gums, but it can start causing bone loss around the teeth. So you might have heard that phrase, long in the tooth. That's talking about gum disease. So you might start getting recession where you can actually see the roots of the teeth. You might start getting loose teeth. And I have lots of patients as an oral surgeon that I'd have to take out all of their teeth. And it's not because they ever had a cavity a day in their life, but you could still get gum disease enough that those teeth are loose or causing disease. Once you get to that point, that's irreversible disease. So gingivitis, thankfully, is reversible. So get out your toothbrush, get a little more um, proactive about your flossing and do a better job. In about a week, that gingivitis should go away. Once you have periodontitis, we can't cure it. It's an uncurable disease, but we can kind of arrest it or kind of stop it in its tracks and hopefully maintain that. And that's where your dentist is going to ask you to do those deep cleanings probably every 3 to 4 months. So it really is a lot easier to prevent the periodontitis than it is to have periodontitis, and then it's gonna, you're buying yourself a lot of time at the dentist, a lot more expense. Sometimes you have to have your gums even numb just to even do those cleanings, and then you really need to be brushing and flossing at that point. So
Well, thanks for joining us on our episode of Mouth Stuff Scared Straight, Erin.
I
Sheesh.
hope so. We need more people to floss.
I'm hesitating to show my teeth on camera right now. I'm like, is she judging me? Does she know I didn't floss this morning? Okay. Well, that's some scary stuff. Thanks for that.
Yeah. Yeah, and
Um,
then when you don't do that, you get Alzheimer's or
oh my
preterm
gosh.
babies or heart disease, all of those things. So I think
Okay.
it's just
Okay.
interesting. There are so many people, again, the biohacker sphere of the wellness people who are doing everything they can to lower the inflammation in their body, but they're probably not flossing. So it's a really easy piece that we can add into our health regimen.
Okay. All right. And honestly, everyone's already doing something for their teeth. They're brushing their teeth. You have some sort of routine around it. Just maybe upgrade that just a little bit. I feel
Mm-hmm.
like I always like that habit stacking idea. Like you want to take more supplements at night, you're going to already brush your teeth. So put the supplements next to the toothbrush. So you just do them both at the same time. So you're going to brush your teeth, just do that next thing. What do you think about mouthwash? We like it. We don't like it. Where are we at with mouthwash?
I have disliked mouthwash before I knew why I was supposed to dislike mouthwash. So,
Go on.
one thing I would say, you're never gonna out floss you're never gonna out mouthwash your floss. Does that make sense? Like,
I see what you're doing. You're never going to out train your diet, but you're never going to out mouthwash.
yeah, I might have
It's
said
got
that
some work.
backwards.
It's got some work before we can put it on a t-shirt, but I'm picking up what you're putting down.
Right. So you can't, if you're not flossing, if you're not doing a good job brushing, your mouthwash is not gonna, it's not gonna pick up the slack for
But
that.
it
So,
burns. That's good, right?
it is not good that it
What?
does that. So the other problem, there are many problems with many mouthwashes. So the first thing is, again, people use that as a crutch, and they should be doing a better job brushing and flossing, and they're using mouthwash instead. So that's kind of lazy man's way, and it's not going to get you where you need to go with your oral health. The other thing about it is that most mouthwash is acidic. Now, acid is what actually causes decay. So, most of the time we get cavities because we eat sugar or carbs, and the bacteria in our mouth called Strep mutans eats the carbs and they poop acid onto your teeth. So, if
This
that
is
acid
getting weirder and
stays,
weirder, and I
I
love
know,
it.
this is terrible, right? These things, people don't know these
I'm
things. They're pooping acid onto your teeth. And if I make it sound disgusting, maybe we can, change some
gonna clip that out.
behaviors.
I'll make that a soundbite for sure.
So they are pooping acid onto your teeth. If that acid stays long enough on the teeth, then it can start making holes, and that's how you get a cavity. Okay. So
Okay.
that's the main way you get cavities. The other way, though, is just putting acid in your mouth. So one way, like sugar drinks, like soda pop, etc., that's like bathing acid on your teeth. But one way to do it is to rinse your mouth with acidic mouthwash. So you think you did a really good job. You brush your teeth, you pat yourself on the back. Then you use the mouthwash, washes all that fluoride away that you just put on there. Hopefully, you're using fluoride. And then you rinse it in acid, and then you leave the acid on there. So it's not actually really helping you prevent decay. Probably it might even be hurting you. But the other more, I think, maybe most interesting thing, and this is recent data, mouthwash can disrupt your microbiome. And we hear about the microbiome all the time when we're talking about gut health. Our gut starts with our mouth. We don't have a lot of research on that, but it makes sense to me. And this is one thing that really points that out to me, that our microbiome of our mouth matters. People who use chlorhexidine mouthwash, which is the prescription mouthwash that I prescribe to patients after surgery, even using that for 1 to 2 weeks, kills the bacteria in the mouth so much that some of that bacteria is good. That bacteria makes something called nitric oxide, which is really important for the health of our cardiovascular system. It helps with vasodilation of our blood vessels and helps maintain our blood pressure. So, people taking those for even a short period of time have been shown to have a significant rise in their blood pressure. So, it has a systemic effect.
Are you familiar with oil pulling at all? Have you heard or used that?
Oh, that's a hot topic on
Is it?
TikTok.
Oh, okay. Because I've done it like a few times. I did it back in like 2013. I was like one of the world's top consumers of coconut oil. Just like
Oh,
personally, I just always with the coconut oil, I'll put it into shakes, put it in everything, rub it in my face, whatever.
clean the
Um,
floor with it.
Clean the floor with it. You know, it's antibacterial, antimicrobial, antifungal. Like
Sure
what
thing.
can't this do? So I was using oil. I was doing oil pulling, and it was just so thick it hurt my mouth, so I stopped doing it. Then I got some like in the last like year ago. I got some like specific oil, like MCT oil for oil pulling. It was a lot thinner, easier to do. What's your take?
First off, I think oil pulling is hard because a lot of the recommendations are to swish for like 20 minutes, and
Who
I
got time for
can't.
that? I need to talk. I need to say stuff.
It hurts so bad, and I don't understand. I can't get you to brush and floss for 2 minutes a day, but you want to oil pull instead. But I think if you swished your mouth with anything for 20 minutes, your mouth is going to be cleaner. So if you want to add that into your oral hygiene regimen, I am 100% on board with it. I think some of those Ayurvedic, you know,
Mhm.
ancient remedies that we are still doing have probably some benefits. And just because we don't know them, science hasn't really shown or we haven't studied it, doesn't mean there's not some benefit. But my issue with the oil pulling is a lot of people like to use it as a magic bullet. They want to replace their toothbrush and their floss and their dentist with oil pulling. So I get a lot of people, scammers, I would call them, claiming that oil pulling is going to solve every problem in your mouth. And if you have a hole in your tooth, it's going to reverse that. If you have cavities, it's going to reverse that, etc. Now, there are some instances where you can reverse cavities. They have to be very small. Basically, it's the minerals start leaching out of the tooth, but haven't actually made a cavitation or a cavity or a hole. So if you can catch it in that stage with excellent oral hygiene, with remineralizing products, that's where like fluoride comes in. It can really help with that. But you can stop it there. But once you have a hole in the tooth, you can't regrow a tooth. And that's why, we have so much trouble with dentists, because we have to get fillings and we have to get extractions, etc. once we get to that stage. So I am all for anything that you enjoy doing that you feel is helpful for your mouth. That probably does have some benefits to it, but when it gets overstated for what it's doing, it's pulling all the toxins and the cancer out of your body, or it's, you never have to go to the dentist or use floss anymore, that's when I have a problem with it.
That's fair enough. Okay. What about tongue scraping? I was like also just like thinking of what my bathroom looks like right now, and I'm just asking you questions about my particular situation. So I hope that's okay.
I think it's your situation is everyone's situation.
Yeah,
It's
that's right.
very
That's
applicable.
how I also see the world. So I'm glad we're on the same page.
Yes, sir. I think most dentists are going to be very on board with tongue scraping.
When do you do
It's
that? Is that a morning situation?
um some of those things, honestly, I don't really care when you do it as long as you're doing it. I think
Okay.
if you want to do it twice a day, or even just brushing the tongue twice a day and maybe scraping, but I think at night is probably helpful, and probably the best benefit is just for bad breath.
Okay. Interesting. All right. Because I and do you have to like have it? Is it like have to be like copper, and you have to like burn sage over it? Is that do you also do that, or is that just a me thing?
It's probably just you,
Okay. Yeah. But I am everyone, so it's fine.
right?
All right. This is kind of like my big question. All right. Because I have heard that a lot of cavities don't necessarily come from eating sugar, but they come from um, open mouth breathing and breathing in bacteria. and just having that bacteria sit on your teeth all night, especially if you're just laying there with your mouth open breathing. What's your take on that? And then follow up on that mouth tape. Do we like it or do we not like it?
So, can I explain kind of the cavity process? We talked about that a little bit already.
As long
So,
as you explain it like you're explaining it to one of your children.
okay. Well, I already talked about the pooping.
Yeah, that was good.
That's definitely
I was
how I
on board with
explain
the
it to
pooping.
kids. So, usually the way we're getting cavities is again, those bacteria are eating the sugar or the carbs. That's a big thing. People think I didn't eat sugar. I ate chips. I ate crackers. I things that stick to your teeth. I think I had to dig that chip out of those goldfish crackers out of your teeth. Those are some of the worst things, actually. So you think you're giving your kid like a somewhat healthy snack, but those are sticking to your teeth. Okay. So they have longer time and duration on there. So really, it's about how much time is that acid sitting on our teeth. And one of the best ways to get rid of that acid is saliva. So, saliva is a buffer. If you remember your science, when you have an acid and you put a buffer in, it helps bring that acid level back down to a normal pH. And so back to kind of that middle ground. And so that happens in our mouth. And it takes about 20 minutes every time you put carbohydrates in your mouth for that action to happen. So that's why it's so important. If you're going to drink a sugary drink, if you're going to eat a snack, it's better to have it all in one serving. Drink your soda with your meal. Don't drink it in between meals, because every time you take a sip, 20 minutes, it's sitting on your teeth, eroding those teeth, 20 minutes for that saliva. So if I take a sip every 5 minutes, I could potentially be bathing my teeth in acid all day long. So when you understand that, that's where I went back to saying, how many times a day do you have to brush? If I'm not putting sugar and acid on my teeth very often, then I probably don't have to brush that much. If I'm doing it all the time, I might need to throw in that third time a day, etc. So now we got to think about nighttime. I have a lot of people who brush their teeth only in the morning because they want to have good breath. But really, nighttime is the most important time to brush your teeth. And that's because what happens when you go to sleep to your saliva?
Dries
Do you
out.
know? Yeah. So you're slowing down your saliva so you're not like choking on your saliva all night, right? So that protective action of that saliva goes down significantly. So if you haven't brushed your teeth at night and you missed a few spots, or you left those crackers or those carbs or whatever on your teeth, then you have a lot higher chance for damage to those teeth. And so that's essentially what mouth breathing is doing. When you're mouth breathing, you're drying your mouth out even more. And so that can definitely lead to decay. So same thing can happen with patients. They have xerostomia. That's a clinical term for dry mouth. A lot of patients, just different medications, et cetera, can cause that. And so we'll see people who had, great dental health, and then not too long after getting on, say, a blood pressure medicine or something, suddenly we just got rampant decay everywhere. So same kind of idea. So it doesn't really matter why your mouth is getting dry. That saliva, though, is really important. So that's why, like chewing gum, we talk about chewing gum is actually protective for your mouth, especially if it has xylitol in it. That's another thing. But that's because that's stimulating that saliva and kind of buffering that acid action, if that makes sense. So if you are a mouth breather at night, then definitely that mouth taping can be helpful for that. Can help protect those teeth and those tissues on top of just the, beneficial airway type things that are a separate issue.
So if we mouth tape at night and we oil pull during the day, we don't need to ever see the dentist again.
Never.
Wow, this has been really helpful.
Until you come see me and I take all your teeth out.
Uh-oh. Yeah, don't threaten me with a good time.
I got drugs at least.
Yeah. All right. Okay, that's super helpful to hear, because I feel like no matter what, like even after like mouth taping for a couple of years now, I'll still, if I don't do it, I'll find myself in the morning dry mouth and just like
Mm-hmm.
that's kind of
Mm-hmm.
that growth morning situation. So this is extremely helpful to hear. I had one more. Tell me about like diet sodas. Is that going to have the similar effect? Because I think diet sodas are also acidic, even though they don't have sugar in them.
Right. That's a really good question. People are usually patting themselves on the back because they're choosing diet. And It's better if you have to have one. We'd certainly prefer you do diet because it doesn't have that sugar in it for the bacteria to eat, but it is still very acidic. I remember looking up the pHs of some of the common sodas. I can't remember exactly. I feel like they're in the 3 to 4 range pH. Normal body would be like 7.4. So,
Okay, so I'm looking at it right now. Diet Coke is 3, Coca-Cola is 2.3, and it's logarithmic, so that's 10 times
mm-hmm.
more. 10 times more
Yep.
acidic. Mountain Dew 3.22, Orange 2.3. Yeah, the lowest one looks like Coke though. Not a
Yeah. And
huge
I,
range, 2 to
I
3.
can't remember what level. I remember looking this up at some point. I can't remember exactly the level where your enamel starts to erode, but I think it's like 4 or something. So most of the sodas you're drinking are 10 to 100 times more acidic than your enamel can withstand. So if you're going to do it every once in a while, it's fine. Certainly diet would be better than not, but it's a hard habit for your mouth on a consistent basis to handle.
According to the internet, enamel starts to demineralize when the pH level drops below 5.5.
Okay, so yeah, it was even lower than I
So
thought.
like 100 times more basic than a Coke.
Mm-hmm.
That's crazy. All right,
Yeah, definitely.
heard it here first. Okay, well, I have two more questions before I let you go today, and I don't think we'd be able to have a talk about dentistry and oral health without addressing the RFK in the room. Talk to me about fluoride. Do we need
Fluoride.
it? Do we need it in our toothpaste? Do we need it in our drinking water?
Yeah, that's a really good question. I would say most dentists are going to be pro fluoride. We're definitely on the fluoride train. Um, there's that argument about if it's poison or not, and the standard kind of line is that anything can be poison is the dose. So you can die from drinking too much water, for example. So most of the fluoride in drinking water is very safe. It's a natural element that's often found in in water. So some cities might actually have to take fluoride out of their water to get more to the recommended levels. Some cities just naturally have more fluoride than others. So acting like it's this crazy chemical is not necessarily correct. Um, I think when you're using fluoride brushing, it's such a small amount, it's just a topical amount. So the fear about that is usually overstated. Although I would say with little kids, it's really important to be careful about it. So you do not want to leave your fluoride toothpaste in a place that your kids have easy access to. I also personally think little kids should not be like brushing themselves because of that. So when
Hmm.
you put the fluoride on the toothbrush, depending on their age, if they're babies, we do recommend fluoride. Um, you just want to put like a tiny, we call it a schmear, you know,
Is that
just
a
a
scientific
tiny,
like goo?
yeah, exactly. It's like goo. A tiny, just a little tiny little bit on just the last couple bristles. When they get a little older, maybe like a size of a grain of rice. And then for older kids and adults, it doesn't need to be more than a pea-sized amount. So that amount that they show you on the commercials is to sell you toothpaste.
And
So
it's very visually stimulating. I like it.
it
The
is.
little
So
curlicue at the end.
exactly.
I always
So
try to do that. I never get it.
that's not necessary, but kids who can't spit it out, then they're ingesting it. And again, they could get harmful enough levels that it could be toxic. But something that we also see is that it can stain the teeth. So you see people with the really, really white, patchy teeth. That's called fluorosis. And that's usually from little kids brushing their teeth and just sucking on the toothpaste and eating it down. So
Okay.
that's what's really important. But I think if you are a little hesitant about fluoride, you're not super interested in that, there are some other alternatives. Basically, we're just looking for a remineralizing agent. So we are using our toothbrush and our floss to clean the teeth. Okay. It's the mechanical stimulation of the toothbrush and the floss that's cleaning the teeth off, getting that debris, that coating that develops called plaque off of the teeth. That's the most important thing. So say you're traveling and you don't have any toothpaste, just brush with some water. You don't have to like rush out to the drugstore to get some toothpaste if you don't want to. But I look at fluoride or remineralization agents as like vitamins for your teeth. So you're just trying to help all of that mineral that kind of leached out from the acid during the day. We're trying to force that back in. So That's what fluoride is doing. It's help kind of reharden those teeth. But again, if you don't like that, there are a few other options. Hydroxyapatite is one that is getting a lot of traction lately. They use it a lot in Japan. The tricky part about that is it has to be the right nanoparticle size and shape and
I
concentration
don't
to
have a
be
nanoparticle
effective.
size checker in my house, so it's
I don't
tough.
either. That's a problem. Even me as a dentist, I haven't necessarily found HA toothpaste that I love because the information is hard to come by. So I've tried looking it up on some, and I know some dentists who call the company directly to ask, but that makes it a little bit tricky. So I've actually found another toothpaste that I really like, and they don't know I'm talking about this. This is just a free promo for them, but it's called Elementa Silver. I'm really on board with that one. I love it because it doesn't have all of the chemical junk that most toothpastes have in there. That foamy, wonderful, clean sensation that you get from most, drugstore toothpaste. It feels so good, but is terrible for your mouth. It's really toxic for your tissues. Some people will even get allergies and mouth sores, etc., from
Oh
that.
goodness.
So I don't like regular toothpaste for that reason. So they really only have a couple of ingredients, maybe 4 or 5 ingredients in there. But they have nano silver, which is antibacterial, antimicrobial, and some calcium that works maybe better than the fluoride to get back into your teeth and to um, do that remineralization process. And I like it because, again, toothpaste tends to have a little acid in it also, and their product does not. So that's one that if I were a little hesitant about fluoride and unsure if I wanted to use that, that would be one that I would consider. It's called Elemental Silver. It's a little more expensive than the traditional, but again, if you only use like a pea-sized amount, it's going to last a long time. But you can give that safely to your kids with confidence. It's safe for them to ingest, so you don't have to worry so much about that fluorosis or that toxicity. So if people have fluoride concerns, that's another alternative.
Awesome. Okay, really helpful. Thank you. Okay, that was like kind of the bulk of the stuff that I was really interested in knowing. But before we go today, I would just kind of wanted to open up to you is like what did I not ask you? What am I missing? And what are ways that we can continue to improve our health using our oral health as kind of like the impetus for there?
I'm trying to think if we missed anything. Those are kind of the big things that I was thinking about.
Tongue scraping. Yeah, same here. I'm always
I
thinking
guess
about tongue scraping.
one thing that I see that happens frequently is that patients, now speaking about patients and not just lay people in general, patients will make decisions about their oral care based on what their insurance will pay for. And I think that that's frustrating at times. I get it because the financials can be tricky. Dental work is expensive. It's very expensive to run a dental practice. It's very expensive to pay all the people on to buy the materials, etc. So unfortunately, it's just expensive to begin with. But I see a lot of patients who won't get the care they need because insurance won't pay for it. So instead of paying to save a tooth, we're just pulling it because it's a couple $100s to take out your tooth. It might be $1,000 or a couple $1,000s to save the tooth. And I think it's a lot of time very short-sighted thinking where in the front end, it seems like you're saving money, but on the back end, the quality of life that you're putting yourself through, if you can't chew correctly or comfortably, you're probably not getting that nutrition that you need. And you think
Opting
as
for
you get
softer
older,
foods.
yeah, you can imagine getting older and what that would be like. Things start shifting around when you're missing teeth, or maybe you get your wisdom teeth out too late and you have some complications because, insurance wouldn't pay for it. Or probably the biggest one I see is people, maybe they're down and out and they switch jobs or don't have dental insurance. They just decide not to go to the dentist at all. And what people don't realize is dental insurance isn't like medical insurance where it's preventing you from having this catastrophic, $1 million bill if you get in this horrible accident type of thing. It's more of like a coupon program. And so you pay money, often quite a bit of money, to then have kind of like a rebate or redemption or a coupon back. And so it might be cheaper to go and pay $100 or, a couple $100 to get your x-rays and your cleaning and your exam than it is to pay your insurance. But a lot of people just give up on their oral health altogether because they can't afford insurance. And so I think that's just a big frustration that I see, that a lot of the times people making these decisions are coming in and I can tell they spend $100 a month on their nails and they're bringing their Starbucks coffee in, etc. And I'm not saying people don't deserve to put their money where they want it or to make those choices, but I think sometimes we don't think about maybe my teeth, maybe a couple $100 in my mouth, my teeth that are permanent might be a little more important than these nails that are going to fall off in a month.
Okay, that's been really helpful because I was thinking about getting like a really like a bright gold grill, and I feel like you're just giving me permission to go ahead with that. So thank you for that. That's what I needed to hear right now.
I think we all like the bling. I think dentists tend to like those kind of
Um,
things. You wouldn't think, but like, you want a gold grill? Yes. Can we put diamonds on it?
yes, yes, and I'm 100% on board with this. Erin, Dr. Sheffield, this has been fantastic. Thank you so much for your time today, and thanks for bringing some wisdom and just saying so many words that I'm gonna have to go look up later. I really appreciate it.
I'm sorry about that.
This is great. Thanks again.
Thank you. Thanks for having me.